Hi, Megan. How are you?
I'm good. How are you?
Good. Thank you so much for being part of our professional development interviews. And we're excited because Megan actually has CASAC experience and also prior job experience, right? And also internship experience. And she's going to be able to talk to us more about her experiences. And if anybody's interested in more of the CASAC track, she's definitely a very, very knowledgeable source. So we're excited to have you.
Thank you. I'm excited to be here.
Yeah. All right.
All right. So tell us a little bit about yourself.
Okay. So I grew up around LIU here. I live in the area actually, and for a long time I was like, I'm not going to go to Post because for me I just viewed it as like a place that people who couldn't go elsewhere, like people who wanted to stay around, went, just because I live down the street.
Right.
So I went to undergrad at Sacred Heart University in Connecticut, and while I was there as an athlete, so I was fortunate enough to be there enough where I could just take a bunch of classes during the winter and the summer, because I was like, I'm just going to be sitting around. So I graduated a year early, so I did undergrad in 3 years, and then I knew I wanted to apply to graduate school, but I wasn't really sure what I wanted to do. So I was like, I'll go and I'll get my PhD. And then I was like, oh, that was a mistake, because obviously no one wanted me because I didn't have any experience in the real world yet besides the very basic internship I did in undergrad. And then my sister, I was helping her look for classes here because she was transferring home. And I was like, you know what, I'm going to just look at the program they have there. And obviously LIU has the counseling program. My old school didn't. They just had applied psych. I knew I wasn't going to want to do that. So I came home, and I started here in fall of 2015. Okay. So I'm going to be graduating in like 3 weeks. I'm really excited. It feels like it's been a long time, but it really hasn't. It went by super quick, especially once you get to like your internships and stuff. It's like, it flies. And so yeah, I'm almost done. Looking to get a job now. It's very difficult to find a place. A lot of places don't take limited permit holders. More places are starting to, but you got to make sure that when you're calling and finding the places that you're talking to people who are eligible supervisors. I was telling Tan before, I had an interview with this lovely woman who was a licensed marriage and family therapist, and I loved the center. It was a private practice, but it was like multiple practitioners. They offered all these trainings for the people who would work there, and I thought it was a really great place. And she was asking me if she would be able to supervise me or if her supervisor would be able to supervise me. So they were giving me the options, and it was really nice that they were willing to figure out what it would take to be able to supervise me, but it wound up being, not going to work. I called the state, and they said, licensed marriage and family therapists won't be able to supervise you. They'll have a hard time even getting approved, because under certain circumstances they can approve it, but it wouldn't work. So I was like a little bit bummed. I was like, no, I really like that place, but there's plenty of other places. I have my supervisor from my internship looking out for me to try and help me find places, and she's a wonderful lady. I absolutely adore her. I would have loved to have stayed there if it was a little bit more clinical. I come from more clinical experience, so for me, kind of working in just like an office and running groups all day wasn't really what I wanted to do, especially since it wasn't really the population I originally wanted to work with. I have background in substance abuse, and the population for my internship was developmental and intellectual disabilities. So while some of them obviously may have struggled with it, and obviously it affects every population, for me it was very different. It was kind of all the way on the other side. And I'm grateful because I got the experience there, and it was very difficult for me to find an internship to begin with. So I would say that for anyone looking for internships, start as early as you can. And when you do go, I find a lot of people ask me or tell me that the places that they're talking to only want people for like longer than the practicum. So I would say if you're definitely knowing that you're going to be
That's just that.
I think
No,
it's
I
still.
think it's play. Yeah, it's according to business.
If you are looking for an internship, and a practicum, I would say what they're looking for is someone who can say that they're going to commit for more than just a practicum, because practicum is only 90 hours, and you can do 90 hours in a month, so it's going to be super quick. So they want someone who can stay on longer, obviously, because it takes time to learn, it takes time to build rapport with clients, and just leaving after 90 hours isn't going to be conducive for anything, really. Some of my clients that I worked with at my internship, I didn't really get them to open up very much until like my last month that I was there. So that's why they want you to stay on for longer.
Right.
Where
did you internship?
I interned at Community Mainstreaming Associates in Westbury. It was an amazing place. I loved every single person that I worked with there, and they made it fun. It wasn't like you show up and you're kind of just, in the beginning, it definitely was a little bit boring because you're learning everything and you really have nothing to do. But towards the end, it was just such an inviting and welcoming environment. Every single day I walked in, I had like 10 people saying good morning to me, asking me how my weekend was. So I think that, especially for me, I like places that are like that, because if you're not talking to anyone and you're just kind of sitting in the corner bored, you're not going to get the experience you want out of it.
Right.
So I think when you're going to look into an internship, make sure that you're looking into places that you think you'll fit in with, and not just for getting the hours done. You're going to want to find a place that you match well with. Same thing with finding a job. You're not going to want to just work anywhere. Obviously, everyone has different likes and dislikes. And for me, one of the things that I definitely like is having a good foundation of other employees around me, because you're going to want someone. It's a very stressful place to work, so you're going to want someone to be able to understand that and make the experience more fun. And I think that's what helped me so much in my internship, because I didn't get an internship when I was looking for my practicum at first. I had a place set up where I used to work, and I used to work as a residential counselor through a MICA facility. So it's mentally ill and chemically addicted, if anyone doesn't know. It was through Central National Guidance. I loved it. I learned so much more while I was there than I did in school. I learned psychopharmacology. I learned about how everything impacts them on a daily basis. You're not just sitting there and talking to them. I'm seeing them when they're eating dinner. I'm seeing them when they're doing their laundry. So, for me, I was able to really see how mental illness and substance abuse impact an individual on a daily basis all day long, not just for an hour once a week. And so I saw the struggles that they had with getting them to go to meetings and getting to go to even therapy or to their doctor's appointments. None of them ever wanted to go. So I learned so much about how to just interact with a person while I was there, and then more so about the paperwork behind it and doing service plans. And so that's where my background comes. So I think that helped me a lot too, because I was able to write progress notes really easily when I first got into my internship. But so I had the option of staying on and doing my internship hours there, but I didn't have a supervisor who was licensed who could supervise me. So at that point, I was like, I'm not going to be able to get all my hours done. I'm going to have to, take my leave and find a place to intern and take a pay cut and really just focus. So I was babysitting, I was interning. So my schedules when I was interning was a little bit hectic. I actually found my internship through another alumni from the program. His name was Z. He was also a CSI member, I believe. He was a wonderful, wonderful, funny man. And so we were in our family counseling class. You were in that class too.
Yeah.
And I was telling him that I was having a hard time finding a practicum and internship placement, and he told me that he had just for fun really interned at Community Mainstreaming. Too many seasons. So many. I always mix them up. And so he had told me that he had interned there just because he wanted to. And so he gave me my now former supervisor's contact information. And so he emailed her and said, hey, I have a friend of mine from the program. She's really great. She needs an internship. Would you be willing to meet with her? Can I have her contact you? And she said, yeah, of course. So I contacted her, and it wound up being a great fit. I stayed on I started in the middle of October, so I had already started my practicum courses for like the fall, and I still didn't have a placement until October. So it was like a month and a half that I was kind of behind everyone else. So I was able to really go. I went like 3 days a week for practicum, which not many people do. It's maybe 1 to 2 days a week, just to keep it extended. But so I was hitting it hard going 3 days a week. So then once internship came around, it didn't faze me to go 3 days a week still.
Because you're used to that whole process.
Right. So it was, and I liked being there, so it wasn't really that big of a deal for me. But he actually was the one who helped me to find a place, and he came back to the site one day while I was interning, and I met his now job supervisor, and so they were talking to us, and he was kind of explaining things, and it was really nice to see kind of where he was now after graduation, after interning there. Right. So I was really happy to see that, you know, even though he came from that same background, I guess he was able to find a new place that he really enjoyed. So for me, that was really nice. And yeah, my supervisor she was absolutely amazing, and she's been such a big help so far. She sends my resume out all the time. She'll ask me if I heard from anyone. So it's been really. I didn't think that it was going to be the experience that I've had so far, and I'm very grateful for what I've experienced. Looking forward, I didn't think I would want to work with substance abuse population, but I know so much about it now, just because I just happened. Every single place I went to, even in undergrad, my internship was at a recovery center. So like I know that that's probably the population I'm going to be working with. For a little while, I thought I would maybe want to work with children and do that kind of stuff, or work in a school. And now I know that really that's kind of what I'm good at. I figured it out, kind of. And that's what internships do. They teach you, or they're going to help you to figure out what kind of population you like, what kind of things you're good at, what kind of like treatment modalities you really get and work with. I would say to explore as much as you can, interact with your supervisor as much as you can, find out what things they like, find out what things they don't like. My supervisor used DBT a lot. That was what she was trained in. So she helped us a lot to use DBT methods in our individual sessions with our clients. And I found that to be really helpful, because now I know a lot more about it than if I was going to be just sitting in a class and learning it. So I think that's been helpful. I think that you have to really try and find like your flow in the field. It's going to be hard at first. I find that a lot of people don't realize that they're going to be competing against the social workers and other. We had a rehabilitation counselor at my site as another intern. So the sooner you start, the better, because they're all looking for internships as well. So they're coming from Hofstra, they're coming from Adelphi, and even from here, the social work program. So they're trying to find the same places that you are, because we all can be supervised by the same people. So that's why, people start late and then they don't get a placement, or they get a placement and it's super far away and they're driving an hour every day to get to their internship. And it becomes draining, and you wind up regretting being where you are. So I would honestly say start as soon as you can.
And when would that be? A semester prior?
They say to do it the semester prior, but so like if I was going to be starting my practicum in the spring, I would have started looking in like September. So maybe even a little bit over the summer, just to get your feet wet, because you want to make sure that you're making as much connections as possible, talking to as many people as you can. Even if you meet with someone for a potential internship or practicum site and it doesn't work out, make sure that you're staying professional, staying connected with those people, because later on down the line, when you're looking for a job, you can probably get in contact with them and see if they know anyone that is looking for people to work for them, or if they're even looking for someone to supervise. now that you have a little bit more experience. So that's probably one of the biggest recommendations that I have is start going on interviews, talking to people, asking questions that are relevant, showing that you're interested. They're not going to want someone who is kind of just, kind of iffy, like, oh, I have to look for a practicum site and an internship site, but, like, I really don't know. Make sure you do your research beforehand, like talking to the people, looking up the places. You don't want to just find a place and say, all right, I want to do my internship here. You're going to have to look at multiple places and talk to people that you know, talk to people who are in the grades, not grades, I guess, but years ahead who have been there, because they're going to be able to help connect you to places. That's how I got my internship. So I think looking back on it, I remember the people who were in my position when I was my second semester in, and I was thinking, wow, these people are like, they're adults. I was a freshly new 21-year-old. I turned 21 starting the program. So I looked at them and I was like, wow, they're really only 2 years older than me, but they're adults. And so I was a little bit nervous to talk to them about internships, but they were super helpful and super open about their experiences. And I think in doing that, it really helped me and even some of my friends to embrace our internship opportunities. I've had some friends along the way who didn't like their sites after doing their practicum and internship there and went to go find new sites and weren't able to find a place. And so they wound up getting stuck in a place that, may not have been what they wanted, or they couldn't really leave. So, but then I've had friends who stayed on after their internships ended and are working for the place now and really enjoying it. One of our other alumni who, I don't know if she was in the program or not, Stephanie Matelli, she during her internship, you have to do a project, I guess, where you implement a program. And most sites say you don't have to 100% do it, but it's encouraged by most sites because you're able to give your input and really do something for the center. So she started a horticultural program, and so now she's running their horticultural program, and it's like she's doing therapy with her individuals through working with plants, and she's teaching them about plants. So it's a group.
That's awesome.
She's running the group, but she's engaging them and doing psychotherapy and teaching them how to cultivate plants and how to cultivate their life. So it's really nice to see that she was able to take something from her internship and build upon it.
Great, yeah.
And
such
those,
a creative
exactly. It's
way.
And so it's those little things that you do at your internship that are going to be able to help you in the future. So you're able to say, hey, I implemented this program at my internship. This is how it worked. This is how it didn't work. This is how I changed it. This is how it might be beneficial. And so that's going to be, it's going to give you a one-up on the other people who are looking for places to work or to intern, because they don't really have.
They don't put in that much effort.
Right, so they're just saying, hey, I need a place to work. They're not showing that they're as interested. So I think making sure that you're really invested in the process instead of just being very passive about it. You kind of got to grab the bull by the horns and really try and, make it work for you, because it's a tough world and they're not going to be looking for people who aren't invested.
Right, exactly. And having that kind of project or portfolio.
Right.
It's
almost like a little artist portfolio that helps you.
Yeah, that's awesome, Megan. So we have another question. So can you tell us a typical day of your work in that internship site, what it looked like, especially in the KSEC?
Yeah, so I'll start with the first place that I was at. My job through Central Nassau Guidance, I was a residential counselor, so I was there to help the individuals with daily living skills pretty much, but I also would do one-on-one sessions with them where we worked on things off their service plan. So for me, a typical day there would be I would get into work at 7 a.m., I would have an hour to kind of catch up on emails, read about anything I missed from the night before, see if any clients had any upcoming appointments, or if they were going to be getting visiting hours that day from whether it was their parole officer or their ACT team. So I would do that for an hour. I would unlock all the kitchens and stuff like that for them. And then at 8 o'clock, clients would start waking up, coming in to take their medicine, so I would supervise them when they were taking their medicine. I was never allowed to pop out the medication for them because I'm not a nurse, but I would have to make sure they're taking the right ones. Some clients may try and trick you, saying they're not taking it, so that's what my job was, pretty much in the mornings, to make sure that they were actually taking it. So once that was over...
So would you, like, check under the tongue?
Yeah, especially, there were a few older clients who you didn't have to really worry about. They would take their medication all the time, and they had been hospitalized for years, so they were like, whatever, like, I've been here since before you were alive, Megan, like, I'm taking my medication. So, yeah. But then there were clients who wanted to use and didn't want to take their medication because they understood the dangers of it, but they didn't really want to do anything. Yeah, so they were like, I want to do drugs, so I'm going to not take my medicine. But then it would make their symptoms worse, and then it would just be, they would fall apart and wind up getting hospitalized or sent to rehab. So that's what my morning would be like. Then throughout the day, I would check on the residents. I would answer any calls from the main office if I needed to. Clients who had appointments, I would make sure that their Medicaid cab came and got them. And I would make sure everyone got to group because it was right next door. And if they refused, I would write a note saying that they refused, and I would use that opportunity to do my one-on-one with my specific clients. So we had 15 people in the house, and at one point, I had 7 clients because there were not enough staff. So that was difficult because you're trying to do all your daily stuff. You have to update your monthly reports on them. You have to do your... they're called annual reports, so you have to do them every 6 months. So you had different people having these different reports coming in at once. So you were constantly doing a lot of paperwork on top of trying to balance everything. So it was very stressful, but I thrive off the stressful environment. So I was able to kind of get everything done when I needed to and really learn fast. I think one of the biggest things for me was we didn't have a supervisor on our actual building for our floor. We had the building manager who was our acting supervisor. So everyone had to do the job of the person above them. So that's, I think, for me, why I learned so much more, because I was kind of like thrown into the senior counselor position, even though I wasn't the senior counselor. So I was able to kind of learn really fast. So that really helped. But so you're doing paperwork all day long, and you're trying to do your one-on-ones with a client. So every client had their own service plan. And so if one of my clients was, one of his goals was to, let's see, what was one of them? Communication. He had just come out of prison. He didn't really know how to communicate with people effectively. He had heroin addiction that was institutionalized, so he was still using, but not actively because he was in prison. And but he also had borderline personality disorder. So he didn't know how to communicate effectively with anyone. So one of his goals was communication. So I would pretty much sit with him and I would say, okay, what are some ways you can communicate with people? Because his service plan was to learn about communication, to effectively, learn different types of communicating with people other than just like fighting with them. So I taught him about assertiveness. We would have to practice it just like we would if we were doing psychoeducation for someone else.
Exactly.
But it was very basic. So then you would have to write your report about how the session went, and then at the end of the month you would write how they've improved, or if they've not improved, or if they stayed stagnant. So it was a way of tracking things that you were able to kind of, if they didn't get it really as much in group, you were able to work on it also, so that it was becoming more common for them.
Right.
So that they could build it. So that's what my typical day there was like. And I really enjoyed it. All my clients, I would say, even the more difficult ones, they obviously were very frustrating, but I'm very grateful to have worked with them. Every once in a while I catch myself wondering how they're doing nowadays, especially the ones that I had as my own clients since I started there. I've heard some things through the grapevine about them, but other than that, it was it was a learning experience. I think one of the things you have to be careful of wherever you work is having your clients contact you outside of work. I have been fortunate enough so far to not have that. I did have one of my clients at my internship try and Facebook friend request me. I told my supervisor, we had a joint meeting on it. It was something that he had struggled with before. So we turned it into a learning experience as opposed to something I was like, oh my God, this person's trying to find me.
Right.
Yeah. So that way it was able to kind of take
some boundaries.
Yeah. You're going to want to set boundaries.
Yeah.
But there were definitely times where I was like, okay, this is going to be tough. Like if I had a certain client come in. So that was a typical day for me there.
And how long were you at that internship?
Well, it was work. It was a full-time job. So I would go there.
Okay.
Yeah, I would go there, and I would come straight to school afterwards, pretty much. The 3 nights a week that I had class, and then I was there.
Overnight shift, or?
I didn't do overnights, but there was a later shift that was from 2:30 to 11 p.m. So then, once you're there at nighttime, the nighttime shift was actually a little bit better. It was a little bit more calm because you don't have people's doctor's offices calling after 5 o'clock. Everyone else is closed, so you're able to really get your one-on-ones with clients done then. So I did a lot of my paperwork that I could really kind of multitask and do during the daytime shifts, and then at my nighttime shifts is when I would focus on my one-on-ones with people because it was quieter, there weren't as many people coming in and out, some people were relaxing, so it wasn't as stressful of an environment for them. So that's when I was really able to kind of take that. A lot of places, they're going to have weird hours. That's one thing that I noticed. Some places will stay open till like 10 p.m., and your last session will be 9 o'clock. So that's going to be, they try to balance it out. Obviously, not every person's going to be able to work like from 9 to 10 every single day. Right. So they'll balance it out, try and have you there in the morning, try and have you there at night, so that it's fair for everyone, and fair for the clients if they have to work or whatever. So I think that is something that I think people have to be aware of. You're not necessarily always going to be finding a place that's a 9 to 5. And so if you're open to that, you'll probably have more experience coming your way. And I mean, I don't mind it, so that's why I was like, okay. Yeah. So that's what I did there. Then my internship in undergrad was at a outpatient facility. It was more like a community recovery center, actually. And so I had individuals there who were still using actively also, or people who had been in recovery for 20 plus years. And so my job there was to facilitate some sort of groups. Sometimes I would answer crisis hotlines. What else did I do? I held workshops on resume building because a lot of the individuals hadn't held jobs in years. So I would talk to them about interviewing strategies. I really liked that place. I think that was kind of my first step into any sort of population, and I learned a lot about the people and kind of how they're not very different from us, and how they come from all backgrounds. And it affects everyone. I mean, there was a priest there. There was so many people. So I think for me, I was able to grasp that it's not just lower socioeconomic status people. It's not just like
seems like that's the stigma around substance abuse.
Exactly.
It's like only a certain
but you
population is
the priest, and that was like
yeah,
wow.
he was a pastor. He was a very, very nice man. He just got, he was certain life experiences taken in certain directions, and he wound up finding his way to drugs. We had someone there who had been a professor, and he wound up coming to our facility. That was more of a place where you had CASACs running the place. It was Connecticut Center for Addiction Recovery. The supervisor there was actually in recovery, and he had his CASAC. So he was
master's levels or just high school?
It was a mixture of both. My supervisor and her supervisor both had a college education, but there were people there who had CASACs who weren't. Yeah, and then my internship in grad school at community mainstreaming. So many C's. It was Connecticut. It's ridiculous. So I can't get away from them. So while I was there, a typical day I would start. Well, first I was working in the morning, so I would go to work in the morning for an hour. I was a babysitter, so I would drop the little girls off at school, and then I would go straight to my internship, and I would be there until like 3:30ish, and then I would come straight to class. So it was a long day, but the time at my internship, in the beginning, it was very slow, kind of reading through people's books. It was very boring. There's only so much you can read about a person. So I didn't necessarily like to read people's books before meeting them, but you obviously have to get to know them. And I found that a lot of the wording in people's files were very vague. So I think that helped because I wasn't able to get the full story. So I was able to kind of interact with them a little bit more and learn more. Right. Obviously, there were some people who had big, giant files because they'd been in the company for a long time. There were some people who had one sheet of paper because they were just starting. So it was interesting to see the difference there. Then a typical day there, I would start off the morning. If we had a morning meeting, we would do our meetings. I would do my supervision. We had group supervision. And then I would start my day working with one client. She was great. I supervised her. She worked at the office. That was her little job. She was there for 2 hours. And she and I, for a while, I started working with her really once I first started there. And I could tell they wanted to fire her because she wasn't really working well. The things that her behavior was escalating at home. And so I really wanted to figure out a way to get her to find what matched her the best. So obviously we went through communication skills because she was struggling at home, fighting with people all the time. And so we did that. But also on the days that she had to work, I would be there supervising her, making sure she's maintaining her behavior and really using the strategies that we were talking about one-on-one in our sessions in the work environment to help keep her calm and try and figure out ways to work that worked for her. So then she first worked at the desk. That wasn't working because she wasn't able to communicate effectively with people who were calling in or coming to talk to people. So that wasn't working. Then we moved her over to a different job that was very slow. It was making IDs for people. She did not. She wasn't very technologically savvy. So for her, that was very difficult. And then it was very difficult getting the people to come in and to do the IDs. So she was kind of just sitting there, and we had to repeat the steps over and over again to try and get her to learn it. And so that wasn't working. And she was very good at filing. That's one thing that she was always good at. And so I brought it up to the social worker and my supervisor, and I said, hey, what if we have her file for the social workers? And they were like, we'll try it out and see how it goes. And she wound up not needing me to really supervise her as much because after some time she really was able to do it on her own. She was able to recognize the paperwork and put it in the right spots without me having to direct her. And so that's what a majority of one day would go to.
So would you say you use a strengths-based?
Yeah, I used a lot of, I did a lot of CBT and DBT with her because it was very stress related. If she got worked up over something, she couldn't separate it. So we did a lot of deep breathing, me and her. She didn't. She was a very nosy person. So we had to have her learn. I had to teach her about HIPAA, and I had to teach her about not reading people's files because that's something that I would catch her doing a few times. She'd be flipping through their binders to find the right spot and just start being, oh, I haven't seen this person in a while. We're just putting the thing in the binder. So I'd have to talk to her about it again. And then eventually she was able to catch herself and do it on her own. And say, oh, wait, I'm just putting things in the binder. So seeing her progress to that from almost being fired to now being able to independently pretty much do something on her own was really beneficial, and I think it was really nice to see. I had another group of clients. I ran groups during the day also. So I would work with her, and then depending on the day, I would run a group. And the groups focused on a bunch of different things. We talked about communication, we talked about hygiene, especially when it started to change, like the weather. When it first became winter, and then again when it became like spring and summertime, we would do the hygiene conversation because a few of them just had very poor hygiene. It's something that everyone's probably going to encounter once or twice if someone's got some sort of
like in some sort of visibility.
In any area, they're gonna hygiene might be something that they need to work on, and so we would talk about that. We did communication, we did interviewing skills, we did volunteering, and so at first no one really wanted to talk. Obviously, just like in any group, they kind of just sit there and stare at you. But towards the end, you pick up on things that they all like. They really enjoyed. They had gone to the Ronald McDonald House, and they thought it was really rewarding, and so they wanted to do more for that. So we wrote a letter to the man who helped them get the volunteering option there, thanking them and explaining. We wrote a letter to the whole office explaining what they did and how much they enjoyed it and what they wanted to do in the future for it. And so that was nice because we were able to get them to build teamwork skills and really just interact with one another positively, give positive feedback to other people instead of yelling at them and saying, no, you're wrong, we can't say that, instead of saying, hey, what about this? So that's what I would do with them. And then I also had a few clients that I worked with individually. So I individually worked with a woman who I helped supervise at work, but I also worked with a younger individual. He wasn't younger, he was probably closer to my age, but he was they have to be 21 to be in our program. So he had very severe anxiety surrounding employment, and he was actively looking for jobs. So it was very much hindering him in finding a place to work because his anxiety was like off the charts. So he and I would do a lot of different CBT strategies. We did a lot of deep breathing, him and I. We did a lot of kind of exploration. He was very closed off. He was definitely one of my hardest ones to work with at my internship because he was afraid to talk about anything. He sought counseling outside of me. I actually interacted with I got permission from his mother and from him to contact his primary therapist to kind of figure out what she'd been doing with him, if she had been seeing the same issues that I was seeing, to really collaborate because it was very difficult at first to get him to open up. So I kind of I would find things that he liked. He liked talking about movies, so I'd find ways to incorporate it. And his issue was his anxiety was causing him to have persistent thoughts, and those persistent thoughts were interfering with his relationships with people at home and his friends and getting jobs. So once I picked up on those persistent thought patterns, I was able to kind of have an epiphany and think, oh, wait a minute, I have an idea. So, because I had been explaining to him persistent thoughts and negative thoughts and how we have to combat them, and he couldn't understand what I was saying. And so I was like, how do I make this in a way that he could get it? So I knew he had liked movies, and so one movie that I thought of immediately was Pinocchio, and Jiminy Cricket, and how he's the little conscience guy, and he will sometimes be talking to Pinocchio, and Pinocchio's like, I don't want to talk to you right now, or he doesn't want to listen to him. So, and then eventually he learns to cooperate with Jiminy Cricket. So I asked him if he had ever seen Pinocchio. He said yes. And I said, do you remember Jiminy Cricket? And he said yes. So then I explained to him how persistent thoughts were like Jiminy Cricket. So I gave a face to the persistent thoughts, and it clicked for him. And from that moment on, he was so open. And I only had a month left to work with him, but we were able to get him to a point where he was able to recognize those thoughts and process them. And so that was really nice to see before I left, because he was now open and he had gotten employment, so he was working.
You had a breakthrough with him.
Yeah,
that's
and
amazing.
So that's a tool now that I use. That I'm keeping my little. I call it my little work belt. So I keep it in there, and to use for, other things. And whether or not it's Jiminy Cricket, it's totally fine. It could be SpongeBob if someone really likes SpongeBob. It's just, I found that giving a face to it helped him to be able to understand and really confront those thoughts.
Right. Like they need to be able to recognize or they need,
right, because if you're just talking to someone, you're like, yeah, you have to really recognize those persistent thoughts and those negative thoughts that you're having constantly. And they're like, I don't know what you're talking about. So when you give it a face, they're like, oh, I know what you mean now. Okay, let's stop this Jiminy Cricket guy from interfering with my relationship with my parents. So that was really nice to see. Awesome. And so that's probably one of the biggest things that I learned there in regards to counseling strategies with people. Because I was able to, it was something I literally, I was sitting at my desk and I was like, how do I get this to work? And then I was just like, oh, that's it.
Right. And it's almost like you have to be very persistent.
Yeah, I mean, it took weeks.
With a therapist
too. And she didn't really know, and so it was. That's the one thing I think I found about having the support network. I was asking everyone, all the other interns. I was asking, what do you guys think I could do for this? I asked my supervisor, and it was just I tried everything. And so finally it clicked, and I think that was more beneficial than it was a group effort. I tried everything, so that's why it was so rewarding in the end, because finally something worked.
And it came from you too,
right? But I mean, I would have been really happy if it had been from anyone.
Yeah.
I mean, just because it was the fact that I finally got him to understand it in the way that I was trying to explain it, and so that was very helpful. And I think everyone else's input for it was really great too, because every single thing I used got me a little bit closer. And I was able to, learn more about how to use it interactively instead of just reading about it in a book like we do for school.
Right.
So I practiced with almost every technique that we've learned about to try and, figure it out. And it helped.
That's awesome. So, what advice would you give students who are looking for internships in counseling, but also in CASAC?
I would say, again, to start early, to make sure you're researching the places, make sure you're looking into what kind of things that each site is doing. Because if you go into a site and you don't know, you're thinking that you're just going to be working with one-on-one with people, and they're like, no, we only do groups. You're going to have to understand that you're going to be encountering it, and groups are very effective for substance abuse populations. So I think any substance abuse population place that you're going to look for, they're going to be running groups, and you're probably going to be running a group. So, make sure that you are able to, if you're looking for an internship in that or a job in that, make sure that you're able to kind of show the potential employer or supervisor that you understand the concepts of running groups, you understand the concepts of substance abuse, how it affects people of all ages, and the evidence-based strategies that you can use in working with the population, how it's very familial systems and showing how it impacts more than one person. That's going to help you to find a place, because that's what the area is moving more towards. From at least what I found, that they're seeing that it's more of a holistic approach than just treating the one substance and saying, all right, you're good, now go live your life.
Right.
So I think that is probably something to look for when you're looking for a place. Obviously, looking it up, you can just Google places, you'll find them. I wouldn't recommend, as far as internships go, and practicum sites, I wouldn't recommend calling all the places on the sheet that they give us on the website for here, because that sheet is pretty outdated. And a lot of, I literally called every single place on the sheet, and a lot of, probably more than half, was they either didn't take interns anymore, or they weren't called that anymore. The person had retired, and they weren't taking any interns. So I would say to look up places really on your own. Obviously, use the sheet as a guideline, and you can see the places that are options. But and But yeah, I would, if you're interested in a place, look for the most recent number on probably their website. Look them up, because when you call them and say, hey, I'm looking for an internship or a practicum, they're going to be like, okay, what do you need? So being able to say, hey, I looked into your site, I really think it would be a great opportunity, that is going to help you to really seem more engaged, and it's going to make people more likely to want to talk to you. So for any internship, really, especially if you're just starting out, if you've never been interviewed before, I would say to brush up on your interviewing skills. It's really, it's not as scary as people make it seem, and I think everyone's so nervous to like call and be like, oh, I need an internship. So if you're open and embracing yourself and just make sure that you're confident and comfortable, you're going to be able to get recognized by more people, especially if you're starting early.
That's great advice. That's really great advice, Megan. And I agree with the, you have to do your homework before you call these places so that you feel, that you seem more prepared, especially in the interview or even just the phone call. The phone call is
that's like the gateway.
Yes, that's the gateway.
Exactly. And then once you get the interview, or even you get the site, you know how in interviews they always ask you, do you have any questions at the end? And I feel like a lot of people, I used to be that kind of person too. I'd be like, oh gosh, I don't have any questions. Right. But if you're looking up the place before, you're going to be able to formulate some questions. I think for internship wise, I would say to ask them what kind of workshops they offer, what kind of learning experience they can point you in the direction of, so that you're showing them that you want to learn more. Because you're never too old to learn, you're never too experienced to continue learning. So I think showing people, they want to see someone who's willing to progress and willing to learn more. Because you're not going to be the same person you were starting than you are the person leaving. And hopefully they don't want you to be the same person. So showing them that that's probably one of the best questions I can think of to ask when they say, do you have any questions? Ask them what kind of workshops they do for interns or employees, and that kind of stuff. Asking them what kind of what's the staff environment like, if that's something that's important to you, because it shows that you're willing to work as a team, and that's going to be helpful. So yeah.
Excellent.
Make sure you have questions at the end.
And it shows that you're prepared, and you're not just coming there because it's an obligation, that because you have to do it at school. You're here. It's right. It shows that you're really interested in.
Right. Making sure you're following up after, respectfully thanking them for their time, is another big thing, because if they're taking time to interview with you or talk to you, even if there's just collaborating with you via phone or email, responding to them, saying, hey, thanks so much for your time. Here's what I got from our conversation, and then ask another question, because then it'll keep the communication going, and you're going to be able to build a more professional relationship with them. So even if you don't get the internship, you can go back to it later.
Right. Yeah. And I think that's also, like, you talked about that pretty frequently, like going, like in terms of getting a job, it's not only important to get an internship. You got to be able to sustain the relationship, the professional relationship, for either yourself or if you can give it to someone else.
Absolutely.
Yeah.
And it also is the face of the university too. Because once we put ourselves out there, it comes back to the university as, these students from LIU Post are very professional and they know the protocol. So that's great advice.
Yeah. Not only does it help you in the end, if you're acting professionally at your internship, and you're building professional relationships, and you're showing that you're willing to learn and you're willing to engage, later on down the line, your supervisor is going to be able to get that phone call from a potential employer and say, hey, how do you know this person? How do they work? And they're going to say, this person was absolutely fantastic. They constantly wanted to learn. They constantly were engaged. And they progressed a lot. So I think that is what they're looking for really nowadays. It's not someone who has a bunch of like experience. Like you could have like 6 master's degrees, but not have the right experience and not progressed at all. And I think that's why showing that progression in every single relationship that you're making with people is going to be able to push you a little bit further along.
Absolutely. We've got a lot of insight as to how we're supposed to go ahead, in this, because like I would say as an international student, it's not really easy to have all those contacts. Like, it's difficult to kind of get that foot in the door in the first place because it's a new country. It's just like this whole new experience. And I think everything that you've said really is very simple to do. I mean, these are like really small things that we can do just and progress.
You're welcome.
Yeah.
So just one last question before we wrap this up. So how can CSI members and anyone else, any juniors or anybody else get in touch with you?
They can contact me on my LIU email. I check it all the time. You guys have it, so you can probably attach it at the end. So you can contact me there. I'd obviously be willing to answer any questions, provide any feedback that you guys, any advice you guys need. I'm always open to it. I have people from undergrad who contact me all the time asking me what to do, and I've been able to actually point them in the right direction in terms of where they should be looking for certain types of programs that they want to, get into. One girl wanted to do what we do, and she had applied to the applied psych program and she was really excited about it, and so I contacted her, and she was asking me all these questions about it. I said, it's really up to you, but this is the experience I've had with it, and this is the experience you're going to have if this is your end game of wanting to be a mental health counselor. And she was very grateful and in fact wound up switching her program to a counseling program closer to her home. So yeah, it was nice to see that I was able to provide the feedback for someone then too. So yeah, I'm always open to helping, and even if you need advice on how to talk to a supervisor, because I think that's a big thing too, is interacting with supervisors can be a little bit frightening.
Yeah.
And I think making sure you're open, showing them that you're respectful and want to accept the criticism, I think is something that's going to be important. And I obviously would be more than willing to help anyone do any of that. Or if anyone has any questions, I'm always around to answer.
Awesome. Well, thank you so much. This was an amazing interview. I'm so excited to have you. And we're so excited as CSI members to also have this information, right?
Right. I mean, it's not just for this badge. It can, it's really useful for anyone and everyone looking to get a job or get an internship, and it's not just constricted to like the counseling field. It's for everyone.
Right. I want to thank you guys, because when I was starting out in the program and in CSI, we didn't have that. We didn't have videos or interviews or even the available. I mean, we did have people come in and talk to us, but it wasn't to the extent that you guys are taking it, and I'm very glad that you guys are doing it, because it's very helpful. I mean, we had so many questions coming in, and they're not always answered, or they're not answered, in a timely manner. And I think that having that extra resource for people is going to be very beneficial, and I'm very grateful that you guys do it.
Well, thank you so much for being here. We truly appreciate it.
Thank you for having me.
Appreciate your time. And if you guys want to get in touch with Meghan, now you know how to do it. All right, guys? Thank you.
you.
Bye.